Our top story today, over 13,700 new cases of COVID-19 have been reported in India in the last 24 hours. This compared to 10,500 the previous day. Now, this is a 30% increase in COVID-19 cases from the previous day. Amid this COVID-19 surge, as many are calling it, there are several people who are now asking questions on whether India indeed needs to brace for a second wave of COVID-19 infections. Among the top 5 states which are seeing a worrying surge in COVID cases, Maharashtra has seen over 6,000 cases in the last 24 hours, Kerala over 4,000, Tamil Nadu, Punjab and Kerala still under 500 cases in 24 hours but are also seeing an uptick. Now, the government of India has said that Maharashtra and Kerala alone account for over 75% of the total active cases in the country. However, amid the new variants that have been found, the ICMR has now clarified that there is no direct relation between the surge in COVID-19 cases and the mutant strains. However, the central teams have been rushed to 7 worst affected states in order to better understand and contain the spike in cases. Now, the centre has asked these states to increase RT-PCR testing, to increase testing on a manner which is focused specifically on the affected districts and to increase the proportion of RT-PCR tests vis-a-vis the rapid antigen test. They've also told states that all symptomatic negatives of the antigen test should mandatorily undergo an RT-PCR as well, and strict contact tracing mechanism needs to be put in place. Well, what does this mean? Is India indeed bracing for a second wave? Dr. Rachna Kucheria, founder of Doc Genie Telemedicine and noted epidemiologist, joins us on the broadcast. Thanks so much, Dr. Rachna, for being with us. What's your assessment? Do you think India at the moment is at a juncture where we're bracing for the second wave of coronavirus?
Thank you for having me. I think it's a little premature to say that. Certainly, we are seeing an uptick in these states, and I would say even locally in our practices in Delhi also, there is a very small but definite increase in cases. Well, we have the learnings from the past year, and I think what's happening is that both the government as well as people, the government is certainly being proactive, and people should also be, sensing that there is an uptick going on. Just hunker down and take all the measures that we did last year. We've had some respite for about 4 to 6 weeks, but there is absolutely an increase going on in those states, and all borders are porous, all activities are on full swing. So I think that we must bring back caution in our lives and try and contain this sort of second wave or uptake or increase in cases that's happening, whatever you want to label it.
Right. 2 important questions that I want to ask you. The ICMR has said that the uptick in cases in certain districts or the spurt in cases is not yet being linked directly to the mutant strains of COVID that are being found in India. What do you make of that assessment? And if we can't link it to the mutant strains, why is it that there's a spurt in cases only in fits and starts in certain states and certain pockets?
Okay, great. Great question. So, I do know that the ICMR has opined on this, but other central government experts have said that the possibility of variant strains causing increased transmissibility in these areas cannot be ruled out. The cluster sampling and proportions of those are being sent for genetic testing, but to accumulate that data and make sense of it and validate that takes a bit of time. The other reasons that could be possible for the uptake, even with Maharashtra, I believe it's more of eastern Maharashtra that is getting harder hit, bordering MP, is basically public movement and some amount of relaxation of the guard that we were all keeping up and not doing as much COVID-appropriate behavior, whether it's pandemic fatigue, whether it's looking forward to the vaccine, whether it's myths about, some sort of herd immunity. But I believe that there has been, relaxation in the public's mind also towards the measures that were known, the non-pharmaceutical intervention, which is mask, safe distancing, and hand washing.
I want to also ask you, schools are being reopened, almost 1 year since they were, shut down due to the COVID-19 pandemic. We are also seeing suddenly a surge in festivities, wedding celebrations, many that had been sort of put off for a period of time. Do you think this is wise? What's the advice that you'd like to give viewers?
I think that some balance has to be struck between things that are essential and, in my mind, opening schools and allowing children the socialization and the learning outside of just what is online learning that happens is essential. Those things must go on, work must go on. As far as celebrations, whether it's wedding or others, I think there should be restrictions. People should themselves limit those in indoor spaces. Outdoor spaces can and could be used with some amount of distancing. So there becomes a bit of balance with what is mental health issues and the stress, strain and anxiety that people are now facing after a year of the pandemic. But certainly caution needs to be exerted, and those things that are discretionary, that people do out of choice indoors, should definitely be restricted. We can all think of it as sort of contraction and expansion. We had a month, when cases weren't going up. But now let's be sensible about what data is coming, what we are seeing, and then contract and take the appropriate measures for a bit.
The government has asked the states, especially, certain districts and pockets where there's an upsurge in cases, that vaccination needs to be expedited. What more needs to be done? While of course the pace of vaccination is something which is a grave concern at the moment.
True. The pace of vaccination definitely could be picked up. It's one of the arsenal we have in our armamentarium. So the vaccination, some amount of immunity, even if it's temporary, of those who've had the virus. And remember, the important caveat is we don't know how long this immunity lasts. And for people who've had the virus to think that, they have some sort of an immunity passport and now they're free to do what they want, not true. So that's the second caveat. The third is, of course, masking, safe distancing, being outdoors if you're meeting somebody as much as possible. So all of these need to happen simultaneously. The vaccination should be ramped up. We have enough supplies.
Yes.
We have a channel and system already in the country, so that I'm sure the government is considering, ramping that up.
Right. Also, I want to ask you very quickly about the new Sputnik 5 vaccine. Does that present as a ray of hope? Over 90% efficacy. They've applied to the drug controller for emergency use authorization.
Yes, it does. Looking forward to reading more of the science, but this was in the coming for a while, and it definitely, presents another option for our large population, that could well do with many options.
Right. I want to now shift our focus, Dr. Kucheria, and if you can just stay on with us. In the light of the surge in COVID cases across 5 states, now sources say Delhi will insist on an RT-PCR negative test for passengers who are coming in from these states which are seeing a spike in cases. So, for passengers coming in from Maharashtra, Kerala, Chhattisgarh, Madhya Pradesh, Punjab, they are going to need an RT-PCR negative test. These rules are going to, come into force from Saturday, that's 27th of Feb, and apply till the 15th of March. Now, this will pertain to passengers who are coming in, but will not apply to passengers who are driving in to the national capital. Now, in Karnataka as well, you need a COVID negative certificate if you're coming in from the states of Maharashtra and Kerala. In Pune, for instance, schools have been shut and several restrictions are creeping back in. Is this enough, Dr. Kucheria, given the fact that we are seeing this uptick in cases? Do you believe that these measures that have been put in place is enough at the moment?
Tough question. And that's a lot of mass movement. But I think at the bottom line, people themselves have to exert caution, because even if you have a negative RT-PCR for the past 72 hours, you could still be a carrier, an asymptomatic carrier that could, that could have picked up something on the journey. So you have a negative PCR from 3 days ago, but you could have picked up something from the journey. You could be an asymptomatic or mildly symptomatic carrier. You come into another household and you could infect other people. So, if you have had to travel, then keeping the masks on all the while, and perhaps having some caution into the new surrounding you're entering, not meeting people or meeting them only outdoors, being watchful for the first 6-7 days. Those are also precautions I think people will themselves need to take, whatever the government is doing and aiding and trying to control. But I think the onus also is on people themselves who are traveling back and forth. And,
what about traveling to the states where there is an uptick in cases? A lot of our viewers have actually asked these questions, on whether it's safe to travel to the areas which are reporting a spike in COVID-19 cases at the moment.
I would suggest that if it's not essential travel, then perhaps restricted, because if in these areas, and again, it's not everywhere, there are clusters, and you could sort of micro plan that geography. But in the clusters that is that's high infection rate, remember any kind of exposure, you're at a much higher risk. So if you can curtail moving into those areas, it would be a good idea. It's how Delhi was, around November, soon after Diwali. Or how the UK became, or parts of Southern California, where the positivity rate went up to 30 to 50%. That meant that anytime you stepped out, you had a 1 in 2 chance of acquiring the infection. So those realities hold true for any of the areas that infection in these areas, Maharashtra or other states, are going up considerably, and there's high population density, and you're not going to be superbly careful, then you're at high risk for sure.
Right. And, the last question, which is again a question that a lot of our viewers have asked, given the option that students have at the moment on whether, they still have the option of availing online classes, is it safe to send students to schools when we are seeing such a surge in cases? Now, Delhi, for instance, there's no talk of opening up schools beyond classes 10 and 12, but in several other parts of the country, we're seeing Telangana schools have reopened today even for junior classes. In Punjab and Haryana, schools have reopened for junior classes. So what about the youngsters? Should they be sent to school?
As I said, it's a good question. And, unfortunately, these are not measure for measure sort of answers. There is, for those families who have those young children who've been out of school, the growth, the development, the learning is certainly impeded. Many, many studies are saying that. Your risk is lower if they're not coming back into a third generation household where there's a more vulnerable member in that house. So I think it depends people to people. If schools give that option for now, while things are quite tentative, even around various areas, I think that's a good thing. And then people will have to make choices when they are given to them. I think we've seen a year of the pandemic.
Well, so, you said, there's no easy answer to these questions because, of course, sending kids back to school and continuing their education is equally important as is their safety. Thank you so much, Dr. Kucheria, for joining us and answering our questions so very patiently. We're going to slip into a very short break, but coming up on the other side, we have a top infectious disease expert from the United States joining us to talk about that grim milestone of 5 lakh deaths in the US. What lessons can India learn? Stay with us. Welcome back. The United States crossed the grim milestone of 5 lakh COVID-19 deaths since the start of the pandemic. Why does the world's most developed country have the highest death toll? Does the vaccine rollout bring hope that this can be prevented, it can be stopped? Dr. Peter Chin Hong, infectious disease specialist, professor at the University of California, joins us live from San Francisco. I want to begin by asking you, why does the world's leading power have the highest death toll? What's your assessment of what went wrong in the United States?
My assessment is that it's very, very tragic, but not surprising that we've reached this grim milestone. And it's not the kind of world record we'd like to have. It's really because of two main things. The first is that throughout much of the pandemic in the United States, there's not been an alignment of science and politics. There's been mixed messaging. And secondly, there's not been, a national strategy until the current political administration. So most of the pandemic was characterized by states having their own destiny and their own protocols. So it's almost like having 50 different countries with 50 different strategies of approaching COVID, but yet these states have not had closed borders or disease screening at the borders. So it makes no sense from a virus perspective.
It's very interesting that you talk about the lack of a national strategy as a probable cause. Masks not being mandatory in the United States, do you think that this could have led to more infections and therefore more deaths?
Yes, so part of the reason why this number is so tragic is that many of these deaths were preventable. A mask is a really good example because even though there were some states like California that had mask mandates, there was no national mask mandate. And again, with a patchwork response, with some in some areas, some in other areas being deficient, there were mixed messages to the people, so you didn't really know what to follow. Secondly, masks were very much politicized in the United States. So if you were affiliated one political party, it seemed really ridiculous that you would not wear a mask as a statement, even though it's really a medical and a healthcare intervention, not a political statement.
You know, I ask my next question with an eye on what's happening in India as well. The pace of deaths increased by holiday gatherings in the United States. How do you think holidays or gatherings or festivities impacted the death rate?
Yeah, so holiday gatherings are really key, and specifically holiday gatherings indoors, which escaped both public health purview and social media shaming. So sure, we got a lot of images of people in packed bars or on beaches gathering together. But when you look at the contact tracing data, much of the outbreak was fueled by private gatherings behind closed doors, out of the sight of much of the public. And yes, it was fueled by Memorial Day and graduation time in early summer. Then there was another surge, of course, bigger surge on Thanksgiving that went all the way to Christmas. And without a break, that was really horrific and really was worse than any other part of the year.
You know, that's very interesting, especially in the Indian context as well. We're seeing a surge in cases in several areas, and now, you know, gatherings, of course, have come into a lot of scrutiny and question. But I want to also ask you, speaking of the high death rate in the United States and even the projected numbers being so high, does, genetic disposition play a role?
Disposition may play a small role in all of this, but really many of us believe that much of the pandemic was fueled by preventative structural issues. So genetics doesn't play a role when you don't have a national message about wearing masks, or if you give false messages around the utility of certain drugs like hydroxychloroquine. That has nothing to do with genetics. But yes, it may play a small role, like every disease that we know about in healthcare. But when you look at data, structural racism, structural issues, system issues, political issues probably play a far larger role.
Right. You know, variants of the coronavirus are a huge cause here in India like they are in other parts of the world. How is the United States looking at COVID variants? Are you at all worried that these could fuel another wave?
It is possible that variants may fuel another wave of COVID in the United States, but there are not going to be any mutations if there's not replication. And for replication to occur, you need to have people, not honoring some of the preventative messages that we know about so well. And if there's a very slow and rocky vaccine rollout, that can also stymie efforts. But the variants are not going to be an issue if there are not enough noses and mouths infected with the virus. And sure, we know about the variants today, like the variant first described in the UK or South Africa or Brazil, and there's even one in California first described in Denmark. But I'm most afraid about the variants of tomorrow, the ones that haven't been described as yet, which could be fueled by unsafe behaviors or false security in thinking that the vaccine is here, right, so I don't need to do anything.
All right. So while you say that the vaccine shouldn't give us a false sense of security, do you believe that if enough people are vaccinated soon enough, we will be able to prevent future waves of COVID?
The vaccine is not the panacea. It's going to be a key prevention strategy, but it's not a panacea. There are always going to be variants. Not everyone is going to get the vaccine, either by vaccine hesitancy or by not being able to afford the vaccine, even though there's COVAX and the WHO efforts, and the U.S. has now been, contributing to COVAX.
Yes. Well, thanks so much, Dr. Peter Chin Hong, for joining us with your assessment. A lot of very interesting things that you've said about what's happening in the US, and of course lessons that India and the rest of the world can learn. Thanks so much for joining us. It's all we have time for on the show today. Thanks for watching.